Okay. So I'm gonna get Cris on and just thank everybody who is tuning in live, but also recording because yeah, this is about to be an awesome. Hey,
Hello, hello.
yes, I was just thanking everybody for joining us.
I should have set up my other thing. I was set up, then I readjusted, and now I feel like, dang. Can you hear me okay? Can you see me okay?
Yes, I can see you. No problem. Yes. Good. I mean, good night. Wait, are you Eastern time zone or Central time
On
zone?
the Eastern time.
Oh, so you came in late for me. Yeah, so with these later ones, it's always so difficult because I was literally like, I need a minute. I gotta put these two kids to bed and then we can get on the
There's
live.
no worries. I know how
Uh,
it is.
but yes, so we have people joining, and as people continue to join, I'll just introduce myself and then I'll have you introduce yourself. This conversation is really gonna be just that, a conversation talking about this, the amazing things that we have been doing over the last few weeks and then things that you're doing and have been doing for years now. So I am Dr. Sherose Arian, she, her pronouns. I am the owner of Rose Pelvic Physiotherapy. And I have recently been doing a bunch of traveling, just learning more, just getting more education, providing education on the transgender experience as well as gender nonconforming. And then I met Cris. And so, Cris, would you like to introduce yourself?
Yes. Hello, everybody. It is Cris. I'm just Cris Avery on here, but many of you in community know me as Mr. Cris. I'm Mr. Cris Avery Benjamin. But in community up north, they call me Mr. Cris. And down south, they call me Cris Avery. So you put it together, you got your Mr. Cris Avery. I am a researcher, strategist, community advocate, healthcare educator.
Yes.
I got many hats that I wear. But I'm
Well,
here
well,
today talking about trans care with Dr. Sherose, and I'm excited.
yes. Oh my goodness. Just
Well,
so
gender
much.
affirming care, because it isn't just trans care, and that's one of the things we're going to talk about.
That is one of the things we're going to talk about. I'm glad you said that because it can be kind of boxed in, right? We're talking about transgender care, but it is gender affirming care, which looks completely like there's a wide range of what that can look like. So let's see. We okay. So we didn't meet. So we saw each other at Black.
I saw you at BTAC.
Yeah.
I saw you at BTAC, but we didn't meet because I was paying attention to everybody because I was trying to get folks to do this survey with Zebra Strategies just to get like demographics about who's at the conference and all that good stuff.
Yes.
So I did see you. That's why when I saw you at WPAT, I was like, she looks familiar. And then you said it. I was like, aha.
Listen. And we're gonna talk about the good trouble at WPAP. We definitely gonna talk about that.
And that rectal seal.
Listen, oh,
I've never met anybody else to get as excited as me about a rectal seal.
you know, in my pelvic health world, we get excited about stuff like that. And so to have somebody outside of that, I'm like, oh, you get it. And like the way you were like, I'm going to this mic, we got to ask these questions. I loved it. I loved it. Okay, so let's go. We'll reverse back because
Yeah.
I don't know about you, but because I've been so busy, I have not, like I literally was working on my recap for BTAC because I met so many amazing people. I took so many good pictures, videos, just, and I was in the moment and in the experience. So I was there. I will say originally what I thought I was going to BTAC for was like a small piece of what I took from BTAC.
We love
Okay.
that. We love that.
So
We love
it
when you
was
get
just
more out of it. That's the beautiful part.
right. So I submitted a proposal 2 weeks late. Let's not talk about it. To, to
I did too.
I was like, oh, this late, but it's fine. They might accept it or not. It's okay. I submitted a proposal because I wanted to do a workshop on pelvic health and the importance of it in gender affirming care because so many people don't know it exists, don't know how it can help, and things like that. So I submitted my proposal. 2 weeks late, it got accepted. I was like, yes, I'm going to BTAC, right? And that was my goal, was to provide that education and, of course, be in these spaces with trans, non-binary, and just allies, and be able to kind of soak up that experience. And that was like a small piece. I soaked up so much. I felt so much love and care and just warmth. Everything that you want to feel as support was in those days of the Black Trans Advocacy Conference. Like, it was everything. So
I don't like for y'all. Sorry.
I was
But
like,
I
what you?
feel like I'm darker than you. So it's like, let me get a little light. Sorry.
Okay, we got a little spotlight. We got a little spotlight. Perfect. So then tell me what your experience was, what your goal was from BTAC.
Well, for me, it was the first time going to BTAC since 2017. I had personally made the decision to kind of fall back, just for my own reasons. Not gonna go into that here. And then with it being the 10-year and the first one since COVID, is like, okay, I really need to be there. It's important that I'm there because I was there at the first one, and just history in the making.
And
Yeah.
wow.
And as a Black, a assigned female at birth now, man, I also bring that experience, and just
Yeah.
wanting to have that space because there isn't a lot of space for Black trans men, Black intersex men,
No.
AFAB, non-binary folks. And so that was the reason for me. It's like a family reunion. It's also sort of me getting back into all of my gender affirming care stuff after 5 years, because I sort of took a little hiatus
Mm.
to heal and all of that. And so much has changed, and seeing the need to get back to it, especially in these political times.
Ooh, listen, that has been, the political stuff has been ever. Everybody has this kind of thing behind us, right? We know, we hear, we see, we experience some of this stuff, and it's there, it's present, and being able to have a space where you can openly talk about that stuff and be understood was amazing. But thank you for sharing that, sharing your experience and why we felt this was important. Yeah, as a loved one of a transgender person, like, I understand some of the challenges that are happening and things that are going on, and I was like, I need to be more educated on stuff. Like, while I provide services, while I'm able to do this, while I understand it from this point, I need a little more submersion, I think, into what's going on, and the people in a place full of Black people. What? All my people, like,
And
people
we
who look
were
like me.
seeing a beautiful
Ooh,
melanation. It was awesome,
it was.
especially the night of the gala. Like,
Ooh, okay,
I
yeah.
bust in all our colors.
So let's go through day by day. So
Yeah,
I got there on, I think, Wednesday, which was like opening ceremony.
that's Tuesday. Then
Oh,
we
then
got
Tuesday. Okay, Tuesday. I was
Tuesday
oh,
night opening ceremony.
yes,
Then Wednesday was the trans manifest,
yes.
like that first day. And then I got there Wednesday night, so I got there just in time for the trans
Oh,
manifest.
okay, so Tuesday night was the opening ceremony, and I mean, I was driving. I was like, I need to make it. I made it there like just in time. Got my all white on, and I was ready, and I was just getting embraced. The hugs, the love, the energy. I was like, this is how you start a conference. This is how you get people ready for this, right? Got my kente cloth that is gonna wrap me. Listen, gonna wrap me in all the love that I experienced there for the rest of the year and beyond, honestly. So that was the start. I mean, if it starts that way, it can only get better. Like, we
Yeah.
can only go up from there. I met so many amazing people that night that I just continued on in the conference with the whole week. So that was Tuesday night, right? And then Wednesday was the start of some of the workshops during the day. And you didn't have a workshop on Wednesday, correct?
No, my workshop was Friday.
Friday.
But
Okay.
I did participate and help leading a workshop Thursday for
Mm-hmm.
guys like us, group, talking about sexual health, reproductive health, and HIV prevention and treatment
Yes.
for trans men and AFAB, non-binary, and intersex individuals.
Oh.
So yeah.
And I think it was at the same time. So Thursday was a jam-packed day of workshops, and I was angry. I was,
Yes, several of us were angry because the workshop I was co-facilitating was up against another workshop I wanted to attend. I think it was the workshop you were in, based
yes,
on our conversation from the W.
there were so many amazing presenters and workshops, and I was like, on my little, on the app, I was like, oh, I'm gonna attend, I was like, oh, they kept telling me it was at the same time. I was like, oh, I guess I won't be attending. But so that was the problem, is that it was a good problem, right? It was
Yeah,
amazing content and just education, but they had to put it in somewhere, and so some of us got a little overlap. So right, so Wednesday started some of those workshops. I started my morning on Wednesday with a yoga workshop.
okay.
Ooh, listen, it just opened me up. It just got me nice and loose and ready to just accept everything that was coming in. So that is how Wednesday started, with some really good workshops. And then Wednesday night was Trans Manifest, which,
Trans Manifest Live, like I was gonna perform, but I'm glad I didn't perform because I enjoyed just enjoying the
oh,
performances.
they were amazing. We had singing, poetry,
Spoken
dancing,
word,
spoken word.
rap, dance, lip sync,
Yes.
all the
It
things.
was just a showcase of Black excellence, honestly, in the different ways that it can look. I was sitting there, I was just in it. And then of course, you got the little ability to give some tips, because if
Oh
you are entertained,
yes, tip your performers always. So we
we'll
love
drop
that here.
a little hit in there. If you someone gets your attention and you watch, you just drop them a little tip over there.
Yeah,
Yeah, and then Thursday we had all the wonderful workshops. I mean, there were workshops for everything and everyone, for
yeah,
family members, for parents, for anyone of the trans. Like everyone had
yeah.
something
They
available
had
to.
the different tracks. So they kicked off the Empower Him,
Mm-hmm.
the Empower Her, the Empower Them tracks, which were the different reflective tracks for, binary ID trans men,
Yeah.
binary ID trans women, and for folks who didn't identify within the binary, that space for non-binary and gender
Yes.
non-conforming
And
individuals.
then we had, what, Thursday night was the um let's see, I think you might have froze on me a
I'm
little
here.
bit there, Chris. But
I'm here.
okay,
Sorry.
okay, good. There we go. We had a little loading.
Yeah, technical difficult.
Thursday night was, what was that?
That was the
The
pageant. So Thursday night
uh,
was the pageant. Oh my
yes.
goodness.
And
I
I missed the
I
pack.
want you to go, well, since you missed the pageant, Alex. So we have our first
Yes.
crown. So I've been there for the pageantry. One year I was a pageant judge because I have cisgender pageantry background. So I know about the pageant circuit.
Oh my goodness.
But the pageant was everything. They had great competition, but this was the first year that they crowned their first mixed Black trans incident. So they had Miss, Mr., and Mix. So the first non-binary pageant winner.
Yeah.
And I'm honored to know Mix Teddy Ferry, who's the winner, and slayed it in all their non-binary
Oh my
greatness.
goodness.
And so I'm so proud of them.
That's
And
amazing.
that's how they've been repping the crown already as the first non-binary pageant winner. I think has been
Yeah.
awesome. And I'm looking forward to what they're doing with their platform and just all the stuff.
I will say that was an amazing thing to see and hear, because um everyone, we're right when they're talking about trans, and the trans masculine, trans feminine, right? The non-binary space can be just kind of there. And so to hear the organizers, and I can't remember their name right now off the top of my head, but to hear them say, hey, this is a space that we are unfamiliar with, but we're learning, and we want to have talks with everyone who's a part of this non-binary, gender non-conforming group, and really just educate us so that we can be more representative and inclusive, and starting with the pageant and having the first mix of pageant winner this is a great way to just be like, hey, we're trying here and we're working on this, and just including all the love.
That's actually one of the things I loved about the conference too, just seeing the different evolution over the
Mhm.
years. Because, sorry, someone's in my door, so my security is letting me know someone's at the door. But just in the evolution, because a lot of people don't know that it was actually at first a Black trans men's advocacy conference,
Right.
and then that first year, seeing the pour out of love from trans women and trans women coming to the conference, they expanded to BTWI, which was a Black Trans Women Inc. Then they added, anchors, non-binary, the parents. So it's just building out the family, and seeing that culmination in the pageant
Yeah.
only made sense and was in alignment with the trajectory of how the conference has gone. So I was excited about that. And shout out to Carter Brown and Esperanza
Thank
Brown,
you.
executive directors and founders of the conference. We lovingly call them Espy and Carter, and that's Cheeto in the background, making sure y'all know he's on security duty. Sit, Papa, sit. And so, just shout out to them and the leadership over the years who've really tried to take in different experiences, voices from community,
Yeah.
and have a conference happen, because it's so hard when you have people all over the African diaspora, and how we show up can be very different. But it
Um,
definitely felt like a
it,
family reunion with
it
the
felt like a family. Every time I saw SB, she gave me
uh,
just the
the
warmest embrace.
Ashley hug.
And a kiss.
The Ashley hug.
It
Yeah.
started off on that first night, and honestly, every time I was like, yes, I will take it. You don't have to ask, but please, I appreciate it. Yes, SB and Card. Oh my goodness, those two have done amazing. And this was my first year at BTAC, so I'm experiencing all this for the first time, and I can't even imagine what it looked like, 10 years ago versus what it looks like now. But I know the love and space that they have created right now has been absolutely wonderful. I'm looking. I was already like, let me book my hotel and everything. Like next year, we in
As
this.
soon as they release the host hotel, we're getting those rooms reserved, because we're not playing any games. And there's something different when you stay at the host hotel versus when you stay off site, because then you feel
Yeah.
like you're not in the mix. You miss those, 1 a.m., 2 a.m. in the lot. Maybe sometimes it's good to miss those 1 a.m.
I'm tired. What?
I need a vacation from these conferences.
Oh my goodness. Okay, so then Friday there was plenty of workshops. Friday, I love the tracks on there. That was like the parent track. That was, there was so much that happened on Friday. With it ending that night with the awards gala.
We
And
keynote the Thursday. The keynote's Thursday.
we missed, yes, the
Thursday was
keynote.
the keynote with Sebastian Smith
Oh,
representing
yeah.
trans men. We had Jade Lenore representing trans women, and then we had Mitch Renee
Uh,
Taylor representing
mm,
our non-binary keynote. And so just all three of them were amazing.
yes.
I missed part of Renee's because I was having some vegetarian, pescatarian food challenges, but I
Oh,
do appreciate them trying to address that, and we still will have further conversations
yeah.
as Black community in the South dealing with nutritional challenges around people being pescatarian, vegetarian, or having food allergies
Mm.
and all that stuff. So,
See, I love that because I had that same concern with someone who was at my table where they're like, this isn't quite, where I'm at. And so, but being able to say that and know that they're going to take it to heart, and next year we're going to come back and that's going to be not a problem.
and Bloody Vegan ATL, I see y'all in Dallas. So if y'all want to sponsor some vegan meals at BTEC, you heard it here first. We're going to tag y'all after this.
Listen, not you, but a little. Hey, that's fine. Let's tag them.
Yes,
Yes.
we will tag you after this. Just so you got 360 something days, so
Mhm.
350 to get.
I would
Let's
love.
call it
I would.
300 so y'all got time. So 300 days to get the menu in, because
Oh, but yes, I can't believe I forgot the keynotes. Those were when I tell you like so much of what I was trying to do. Part of the week was trying to hold back tears, and in happy tears and hold them back because I was like, I just did my makeup. Like, but they was running because everyone was just saying, they were saying the truth. They were talking the truth, speaking the truth, speaking to things that I was like, oh my goodness, how did you know I was dealing with that? And I was like, this right place, right time is what that was. Those keynote speakers were amazing. I can't believe, listen, my brain is like, so much happened
I
now.
know how it
Oh.
is. So I got you. I got you.
So then, yes, then Friday we had the workshops during the day, and then the gala. Ooh, when I say people were out, oh,
People were stepping in
stunning.
all forms.
Oh,
We had folks who like to dress more casual, but they still came out with their casual stepping on the carpet stunt. And then, of course, people had to stunt with the gowns and the suits.
I was like, are we at the Met Gala? What is this?
It was very much given Junior Met Gala.
And everybody walked the carpet. Everybody walked the red carpet. Some people, I was taking notes in line, like while I was waiting, I was like, okay, I was getting some notes. They were like, okay, it's left, right, center. I was like, okay, let me make sure I get my look right on this on this carpet.
You're like, they're not gonna stand me up.
Listen.
I can't wait to see the pictures when they release their pictures from. I'm
Yeah.
excited.
Yes, I mean, they probably have so many because wasn't nobody shy from a camera. That's what I know.
Oh no. This year wasn't the shy year. Like there's been years where I'm usually the one who's like, no photos without consent. Where's my no photo badge? But this year I gave my disclaimer in advance, and other people I know who are not always big on photos were also open to being photographed, just because it's actually been 12 years since the conference started, but this was the 10th year because of the 2 years they missed because of COVID. So when you've been in it that long, it's like you can't help but not to take pictures, even if you're not.
Because you want people to be like, you have a little FOMO, right? Like you wish you were here.
Right.
So then for me, Saturday morning, I left, which I know I'm like, oh, this was.
Next year you won't make that mistake. You didn't know. You didn't know. That's a
I
first
didn't
year
know
mistake.
it, but I was like, I gotta get home. I'd have been gone all week. These
That's
kids
true.
want their mama. But I was like, it was a family
That's why
reunion.
next year you gotta bring the
I
kids and put them in
have
like
to.
the kids zone. We're gonna reactivate the kids zone. Because
Yes.
the first year we had the kids zone with Carter and Espy's daughter Jayla and my daughter Naya, and they were the only two kids the very first BTAC in the kids zone. And now looking at them at 13 and 14, we're like, oh my God.
Yes. So I came back and said, listen, we bring the kids, we doing BTAC together next year. Like this is a family affair. Regardless of if I'm here for a workshop or for anything else, I'm here and the kids will love it. So that was where I missed out on the family reunion because oh my goodness. I saw pictures though and I was like, I was
So
on
I'm
the
gonna
app. Like,
put everybody onto the family reunion. I'm gonna bridge it. So the Saturday was the family reunion. So we went out to Circle R Ranch, so we had bull riding, armadillo racing. I want a can of armadillo milk. Scroll the feed after this to see me with the can of the armadillo milk and me blowing on an armadillo's tail for armadillo racing. We had snow cones. We had nachos. They had food. And they did address the food issue because us vegans and vegetarians were ready to starve, but they did make sure to have some food for us. So we didn't starve this year.
all right, all right.
But it was just a good all around time. We took the group photos, line dancing. They did kickball, football. Again, pictures in the feed. We had some people turned into cheerleaders, and then after that, the ball was that night, and the theme was the Wiz. And
That's right.
people came out, and this year we had trans man performance, and they came out for trans man performance. So you can catch my feet on my timeline. It's what day was that? The April 30th post. I have the pictures from the trans man performance because a lot of times people are used to trans women doing Vogue performance, but trans man Vogue performance, they were not playing. And for trans man body, shout out to Dean. he was not playing. So we came out this year for this ball. The Transgender were not going to be shut down this
Oh
year.
my
So it was
goodness.
just great to see people loving themselves in that way and celebrating and being unapologetically them.
Ooh, unapologetic. Yes. Yes. Oh, we do have some people here who commented. Listen, if y'all have any questions, anything you want to add, I know we have Sultry Company, Tiara here, Bougie Vegan. Listen, Bougie Vegan is actually a Huntsville local vegan. Listen, if you want to sponsor some food for BTAC next year, we definitely listen.
Well, in Alabama, after I left BTEC, I know we're skipping after BTEC, we're going to talk about WPATH, but I actually had a little detour to Alabama to the Gulf Shores to check out Take Resource Center. Shout out to Take Resource Center
Yes.
out in Birmingham, Alabama. The Black Knights, which is a trans men's program led by Logan Boyd, brought me out to there. So before I went to WPATH, I got to be out there. So I definitely, if you're in Alabama, be sure to check out Take Resource Center because they're doing a lot of major stuff for the community and just always trying to build capacity and see how they can truly service. And anyone who knows me knows, like, I don't shout out people like that unless they're really intentionally doing stuff. And since
Yes.
then, they're there, they're closer.
Yes, listen, I love having the Alabama resources, Huntsville local resources, but then, global resources. But yes, anyone who's here and that was the other thing we were talking about because I was like, wait, you were just in Birmingham? Like, first of all, Cris, you be everywhere. People think I be everywhere,
No, I
but
really be
you be
everywhere.
everywhere.
Like, there was one day I was in New York, and then the next day I was in Atlanta for an unplanned trip. And someone
Exactly.
was like, I thought you said you weren't traveling for 2 months. I was like, well,
Yeah.
if somebody buy a flight and I need to get on it, I'm going to get on it. I just need a private jet,
Oh
though.
my
So.
goodness. You
Or a
just need
friend
a
with a
private
private jet
jet.
to give me a seat on it. I don't need a private jet because the anti-capitalist party is like, that's too much money. Like, that's what you're but I don't like TSA.
We shout out for a private jet sponsor.
Yeah, shout out to a private jet, to my flight folks out there. My private pilot friends, let's rekindle them friendships.
Oh my goodness. So, okay, yeah, before we move on to W Path, right, we have Shantae here, who is one of my wonderful colleagues and friends. Yes, girl, you gotta be there next year. Yes. And then we have like a Prince here. Hi. So before we get into W Path, okay, tell us, because you are traveling all, what do you be doing when you doing all this
So
travel? You're
honestly
educated.
and truly, what time is it? So sometimes I am exposing my body to share my surgery results with people of trans experience who may have not seen dark complected men have the same procedures, whether it be top surgery, total laparoscopic histo scars, or as far as genital surgeries. Yes, I do fly around the country and expose my genitals in
Yes.
inappropriate ways. Like, it's never been like some sketchy, like, ooh, I feel gross way. We set the environment of like no cat calling, no touching,
Mm-hmm.
unless the person says, please cat call me because I finally feel sexy and want to be cat called. So my workshop, so I spoke about the Guys Like Us workshop, but the workshop I did Saturday was the lower surgery show and tell.
Mm-hmm.
Because when you look online, there's a lot of low melanin, we could say white
We
people's
can't.
results that you see.
Yeah.
And so as a dark-skinned Black man, and also as someone who went for above 6 inches, because a lot of these surgeons are Caucasian surgeons who tell you the average penis size is 5 to 6 inches and
Wow.
try to give you 5 inches. And for me, that was not going to work for me. And so being real about that and having created online spaces, and no, not just Black men, but other men, but a lot of Black men ask me about that. So being able to have those conversations and share my body or share research, because I
Mm-hmm.
do have access to conferences like WPATH where the minimum seat was
Yeah.
$1,300. And that's if you're a student.
Yeah.
you got a cheap seat for $1,300, but on the top end it was $3,000
It
to
was. got that early bird special now.
Next year.
See, Cris, you're such a good resource. I knew it.
I hook people up. I know I get people in for free, cheap around it. But
But
yeah,
that,
so I go to these conferences and then bring the information to people who may not have the financial or travel or social access
yes.
to attend those. Because as you saw,
Mm,
WPAC was providers. There wasn't really community there, even though there's space for community to come.
yeah,
There wasn't community really
yeah,
there. So
yeah.
unless
That
they're
is
community and provider.
that's amazing. Let's just I'm gonna take a minute to just give you your flowers for your
And
vulnerability to do that, right? To share your body.
it's
That
nerve
is
wracking. I'm gonna be honest. It's more nerve wracking to expose my body to other Black, trans, and
mm-hmm.
non-gender gender variant people
Yeah.
versus like being naked at the gym or something. Because nobody's really like paying attention,
Yeah.
nothing. And, well, now they might. They might be like, ooh.
They're not acting
But
like you. They're not
they're
being like
not
right, but
right. But when
it's a
you're
space
around
that's
trans people,
needed.
there's like this hyper, you know, fixation. And also, when I had my surgery, I had my last major surgery procedure almost 9 years
Uh,
ago. So also the technology has changed, things have changed, and two of the techniques I had done weren't being done really in the U.S. in the
mm,
way that they were being done. So even that and talking about those things and the risk related to that as well as the benefits related to that.
yes, yes, all of that because as a provider and looking for resources, looking for pictures for education, it is very difficult. And then if we're talking about any type of melanin, it is even more difficult. One of the barriers that I discuss in my workshop for BTAC and that I discuss in plenty of my workshop is that the representation of what skin colors, different skin colors look like when we're talking about models and anatomy and being able to know and understand them. And we need that, but we need a safe place for that to exist and people to ask questions and understand that, there's no judgment here because there's really not. I have heard and seen that, porn sites are where people are getting their education from at times. Which is sad.
I have a model that sent me after he was done with all of his stages of surgery, sent me his porn link and said, I have people who will fly out live to be at these conferences and show and tells if they're already going or it's easy for them to access. And then I have others who will send me, pictures in a secure way. And they know I'll show them to providers like appropriate pictures I showed you on my phone and
Yeah.
Gianna and other providers, but then also community members. I should. They know I'm not emailing it to anybody that's not going on the dark web, but
Yeah.
we had to like turn to porn sites and these sort of underground show and tells to get access to the photos we need. And it's 2023.
Right. Like that is
That's
that is so the work you're doing is absolutely amazing. Being this live model, being this educator, being that whatever it is needed to be able to push forward our community, like that's amazing. Because we had to stop and appreciate that, Cris. All right, we
I
had to do
appreciate
that.
that. Thank you. Thank you.
So then we officially met at WPATH at Mount Sinai in New York.
Yeah.
And when I was going back and forth, like, do I go? Do I not go? Do I not? I was like, I have been trying to see a live surgery for a while now. And it's a place where I'm like, okay, that is for me, I need the anatomy. I want to see, I want to understand. Like I can in theory understand what happens, but I want to see and feel like, anyway, so I've been trying this and it's really difficult when you're working with, you know, centers and things like that. But to be able to see multiple different from trans feminine, trans masculine, or even just learning about the different kinds of gender non-conforming procedures and things that are out there too. I was blown away by that. So yeah, speak a little bit or a lot of it on
So when it comes
WPATH.
to WPATH, my relationship with WPATH is more intensive. A lot of people don't know I was on the planning committee for the first, well, not the committee, but the surgery side. I was part of the surgery team for the first WPATH. So I was helped identifying a patients, making sure patients were mentally and emotionally ready, not just for the regular surgery they're having, but your surgery is being live streamed to a room of surgeons and providers and other people. And then also being an insurance biller. I
Yes.
have a background in insurance billing and coded and work for years, and I've been working in a hospital system since the age of 14.
Wow.
My first on the books job was in hospital administration at the age of 14. And then from there, and then from there, because I was in STEM, medical research and stuff like that, I can always get a research or some sort of job at a hospital. And I use that to couple with my trans care and have been doing insurance billing and coding. So I've been an insurance biller for Bowers, help build capacity for the codes that now Miro, Pirouette, Ting, NYU, and a lot of other institutions have used, but those were the main ones I
Yeah.
had started out with. And even so all of that, like
Yeah.
coming to WPATH and then seeing the surgeries being done and talking to people about new techniques as well. So the first day, the Thursday, is the didactic day where they do, the PowerPoints, and they were talking about hormonal care, adolescent care, adult care, and the controversy right now around adolescent care and safety concerns. I won't go too much into that out of respect for what we've discussed at the conference, but the fact that surgeons are getting death threats. I've gotten death threats before doing trans care stuff, and I've been followed by a white supremacist hate group on and off for a while. So you're just trying to help people. And what a lot of people don't realize about gender affirming care is the research, the techniques, and the things that are being done at WPATH conference. More cisgender people benefit from them than the trans people who help innovate them, if you think about it. Yeah.
Which is, it's interesting because I will say that first day I wasn't sure what to expect because this is my first. I've been a member of WPATH for a couple of years now, and so this is my first conference that I was able to attend. And I was like, okay, we're about to be immersed in all things just trans care, gender affirming care. And it did. We got that didactic part of it where we're talking about all the different resources from mental health to spiritual health, which was for me an amazing thing to learn about.
I love that. That was the first time I saw that incorporated, and I appreciated that they started to bring that as part of a role in the interdisciplinary teams and why it's an important role for people.
And that was a big part, is interdisciplinary, because frankly, any surgery that's happening to anyone's body the surgeon can't be solely responsible for it. And there's no one person who's solely responsible for taking care of the patient and making sure they're successful. It really is interdisciplinary. And that is why I was there, because I was like, okay, y'all, first of all, I'm ready to fight for my pelvic health education and experience. And I'm like, everybody needs this. And I don't know, I spoke to one, she's a resident after the conference. She goes, okay, you made it real clear that I probably should be sending people to pelvic health. I was like, I don't know if y'all heard me. I mean, I said it every day. I just had to make sure you knew that pelvic health was important. So to understand like that interdisciplinary, like to really hit on it and really talk about it and bring different people was awesome. And the different techniques, because I don't know how many surgeons are up there doing the exact same surgery completely different ways.
Right. So that was something that I appreciate they discussed too. And I don't know if you caught it, but I would ask certain questions and certain surgeons would look at me because they're like, Cris, you know the answer. You were in the OR for this answer. Because I have watched surgeries from OR side. But the thing is, they all do it differently. Some based on their training, some based on complications they've seen. And some of the surgeons do one size fit all procedures where they try to do something so no matter what, hey, cut it out, thank you, so that no matter what can you go that way, so thank you, so that no matter what the surgery works for everybody, for the most part, obviously. And then other surgeons who really individually customize. Like there's some surgeons I've seen their coding sheet, and every time their phalloplasty coding sheet is different. Like outside of that main code, the sheet is different because they change it because they treat patients individually. And seeing those different schools of thought, I really respected and appreciated. And I remind people of that because sometimes when choosing a surgeon, people will say, oh, well, I know people who went to that surgeon and loved their results, bless you, but that surgeon isn't the best fit for you. So you'll go to that surgeon, but you won't be happy with your results because they're not a good fit for you. Things like some of the surgeons, actually most of the surgeons spoke about how they will not do urethral lengthening and phalloplasty without a closure of the vagina, but other surgeons will do urethral lengthening. They just let you know that you're at higher risk for complication.
Yep.
But I also know that some of the surgeons willing to do it, their patients are going to the other surgeons who saying they don't do it because they're repairing the chronic urethral issues, because people really don't understand how much of a nuisance not having a vaginectomy or closure of the front hole can impact urethral health in a post-op urethral lengthening.
I love it. See, that was the part that I was just getting into and loving, absolutely, like listening to the different like urethral lengthening and the anatomy parts of it. That's where I just start to nerd out. I'm like, yes, show me more.
This is the only time I could really tap into my full nerd and still keep my like swag card, because at the other time they're like, all right, Chris, nobody. But when I'm talking about surgery, they're like, ooh, tell me more.
Yeah, I was like, okay, so that's how I get your attention. But you know, I love it because your insurance background, it depicts so much of what it just has a different perspective on what you see and understand, because understanding codes and things like that, you know, for me, I have to understand them because I am an out-of-network provider. However, I need to know the codes that aren't going to be reimbursed because I want people to have that ability if they want to. And so codes are, I mean, we know insurance is insurance. So we have to kind of play their game. So that is an amazing thing to know, because
play their game better.
Well,
hey, United Healthcare, Amita Care at the Cigna. Y'all know y'all love me.
listen, we know. They said, listen. He said he knows. They said he knows insurance, and I listen. I know you know your insurance. You were telling me something. I was like, oh, okay.
Yeah, that's one of the things too for the rest of 2023. Having met you and listened to other providers at WPATH, seeing the need for insurance things, and now that the surgeons and a lot of the surgeons' office and primary care are comfortable with their codes, like the auxiliary specialties, making sure you're paid properly, because that's another thing. You can get higher rates of them, but that's a whole other conversation. But if you don't know those things, insurance will get away with underpaying you for your services.
Ooh. Cris, I think we just found out we're going to do another live and talk about insurance. Cool. That's what I just heard. Which is, I mean, that's an amazing, like, you are just a wealth of knowledge. And that is what I felt when we talked. I was like, oh, you just know so much, and your confidence, right? So they did have the microphones there for us to ask questions. And we asked questions because I'm a curious person. I want to know. And you were like, I already know the answer, but I'm gonna ask y'all anyway because I want you to educate these other people who don't know the answer. And I said, okay, Cris. All right.
Because I know there was one surgeon who I know, if I didn't say that, they were gonna cop out on answering certain questions, not because they wouldn't answer the question, but they're like, oh, no one. Some surgeons feel people don't care about things that we really do care about.
Yeah. Because when you're so into it, right, like they've been in this space for decades, right? You've been in insurance, you know, you've been in this for so long. So sometimes you get kind of stuck in that feeling like, oh, nobody wants to listen to this. No one wants to hear this. But there's always a new person who hasn't heard what you've said before. Even though you've said it 1,000 times, this is their first time hearing it. So yes, I'm all for another live. Yes.
Okay. We love that here.
But right, so having to just like kind of wake them up, be like, listen, while you might be so used to this that this seems boring, someone else needs to know this, and I know the answer to this because I've been doing this with you for however long, but you need to educate some of these other people. So you had no problem saying,
oh, the surgeons, no, I've actually told some of those surgeons like off before, respectfully. I've gotten a couple of them together respectfully. So sometimes I'm like, are they gonna curse me out, or are they gonna but they always understand where I'm coming from, and I always preference it. I challenge you, one,
Yeah.
to be accountable to the people, as well as to remind you of your responsibility and accountability as a surgeon and the Hippocratic oath you took, which is
Mm,
hard because you mean to do no harm, but sometimes when you're being so conservative, you're doing harm, and
yeah.
just reminding them of that balance. And there are surgeons there who I told them we would be here in 2023, and they were like, no, we would never. And now they have multidisciplinary programs, but they used to say you can't have multidisciplinary programs, and insurance pay for it, and this and that. That's what they used to tell me in 2008 when Dr. Hazen and I were working together. I don't know if you caught that.
Oh my goodness. Listen, I know one thing you was going to use like, oh yeah, I know this doctor and this surgeon this way because you have worked with them. You've worked with them, you've been in these programs, you understand it. And that is, I mean, just that alone is amazing. But then to now take that and provide it to the community and be able to say, hey, this is what we need to be looking at, asking for, thinking
Also,
about.
it breaks the barrier because one of the things I learned, I grew up in the South Bronx, and the South Bronx is considered like poor. Nobody wants to go there. Oh my gosh, but we've done groundbreaking research in the South Bronx because you would see people flown in from other countries with rare medical conditions. I had a few rare
Mm,
medical conditions, and noticing that when when people feel that you're worth research or you have enough money, that's when they'll go above and beyond to save your life. And
mm,
I always had access to healthcare, but I noticed because I was from the South Bronx, if people assumed I didn't have money, how they approached caring for me was different from
mm,
doctors who knew my family and doctors who knew my insurance.
mm.
And so that has really colored how I view the medical system, as well as how I hold the medical system accountable to the people and educate people.
Yes.
Because half the time, the difference between good care and bad care is you saying, I know I have a choice in my care.
Ah, listen. Oh my goodness. That is huge. For me, um, oh my goodness. Bowers, Dr. Bowers, I think she was the one who said, I hope that more of these conferences are open up and it's not just surgeons and it's not just providers that are, kind of talking amongst ourselves because so much education and just perspective is had when you're able to talk to someone that's not in your, opening up past the surgeons, like y'all can talk about your procedure and stuff all day. They got into conversations with each other and started getting into the weeds with it, and that's great. But there are people who haven't even fully gotten the basis of what they were talking about and just needed some of that to just,
At one point, I feel like they switched to peanuts, and a huge chunk of the audience just started hearing wah 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 because like their eyes glossed over. But that's why I appreciated the Friday and the Saturday where
mm-hmm.
they were showing the procedures live, and that people could ask questions.
Yes.
And I was gonna ask if that was a rectal seal, but I was like, no. And then someone else said, I was like, okay.
So let's talk about it. So it was a
So
was
they
a
were
Dr.
doing,
Tran,
the vaginectomy, so the closure
right?
of the front
Correct.
hole, in the first stage of a phalloplasty. And since Dr. Miroslav Djordjevic from Belgrade, Serbia, who
Okay.
now does surgery at Mount Sinai sometimes because he has surgical rights there. He was leading the first stage phalloplasty, which in the technique he does is the same as a
Right.
metoidioplasty. It was slightly modified because they didn't release that top ligament. That's why you didn't see a change in the length of the phallus, but everything else you saw a change. So when they were examining the canal to
Mm-hmm.
start the vaginectomy,
Yes.
soon as they put the tool in there, someone pops up.
That was that rectum. It was the
Yes.
rectum.
So would you like to explain, since this is your area of expertise? I
Oh,
know you can articulate
listen.
it way better than I can in this moment.
Yes. Okay. So it was in between the live surgeries or also the other surgeons, but also providers and community members, well, not community members, but other providers doing their talks. So it was kind of multiple things happening at one time. It was perfect timing because I believe it was the gynecology
Yes,
talk that was
Dr.
happening.
Tran, who
Oh,
does GYN care
yeah,
at Mount Sinai, her and Dr. Rodriguez are the two GYN specialists
yes.
that do the gender affirming care for trans and transmasculine individuals who might need vaginectomy or hysterectomy. And as she was talking about
Yep.
vaginectomy, the complications, you see,
We pop
they
back to
pass it to
the
Dr.
screen, and
Moreau.
right in that canal is the rectum coming up from the bottom of the vaginal canal into, and a rectocele is what it's called, but it's a form of prolapse. And so, and it was pretty significant, and from that angle.
Yeah.
And so, of course, they're talking, okay, we got to press that down and make sure that we get everything. But for me, that immediately got my attention. I was like, oh, I got to talk about this, right? The first thing I said was that patient is going to need pelvic health therapy, right? Because they do. There's already, when we know prolapse happens, right? The patient was young. I believe 21 was the age of that patient.
Yeah.
They were young. And so for me, when we see stuff like that, it doesn't necessarily mean that there's been a pregnancy or anything like that. People have prolapse for all kinds of reasons. And so that we have to find the underlying reason why that person had prolapse. And then, listen, I love this. I love this. And then we're doing any type of surgeries or procedures, changing the integrity of that pelvic floor. We definitely make sure that we're addressing that stuff. And so that was the first thing I said. I was like, listen, that patient is going to need pelvic floor therapy. But also, one of the things they talked about was a change that I hadn't realized was that they can either cauterize and burn the lining of the vaginal canal versus doing a vaginectomy, which is removing the actual vaginal canal.
And
And
I talk
so
about this too, because a lot of people, they use the term vaginectomy to cover all things, but there is a
there
difference
is
between a
a difference.
vaginectomy and colpocoesis
Yep.
and what is done, and asking those questions because it does increase your risk of pelvic floor issues if you have a full old school vaginectomy, which does a full removal of the muscle. Most surgeons in 2023 do a partial vaginectomy, which
Right.
is where they remove some muscle and ablate the lining mostly, but they don't do a full removal because they want to support the pelvic floor. And I think for me, having you there as a pelvic floor specialist, being able to professionally articulate what you saw was so helpful, because when I do presentations and I talk about interdisciplinary stuff, sometimes because it's not my specialty or
Mm-hmm.
I know so many things, they don't always listen to the area in which they know me in the least, if that makes sense.
Yes.
And so you being there saying, I see it, they're going to need it, make that referral. Now everyone in that room is going to really say, well, this is a referral I can make for the patient. This is a way I can help a patient. And then having that conversation in the hallway with Dr. Tran as well, as the GYN, and saying, well, on at different stages we can provide pelvic floor care, because even me post-op, I get some pelvic floor care. My insurance pays for this nice pelvic floor therapist to do scar treatment care and massage my penis once every week for to reduce the scar tissue.
I'm so
And
glad you said that, because a lot of the education that's coming out and a lot of the therapists are not doing anything to the penis, whether we're talking about cis males or any type of trans affirming care. They are not really addressing the shaft or anything, and we have to. Why would we do clitoral hood, not stretching, but and the words are just,
therapy,
it's like,
yeah,
yes.
clitoral head
So
therapy, vulva
yeah,
therapy, and all of that, but we neglect the penis in some ways. And
yeah,
what I've been noticing, and I was talking to my pelvic floor therapist about this. Shout out to Stephen. I'm gonna
yeah.
connect you guys because I think he'll be able to to shed light on this, having seen so many things. And sometimes we would just sit there and discuss, you know, pelvic floor health while I was getting my massages. We
Hey,
try to discuss anything that's gonna like take away from, because it's like, it's just, yeah,
yeah, no,
that kind of therapy always throws people off
yeah,
unless you think of it in the medical frame in which it's being done.
yes. And I think sometimes that's the hard part that people aren't, they're confusing a lot of things, and their discomfort is where they're then practicing in. And I'm all about what's best for the client, the patient, and I'm not gonna, if we're trying to change scar tissue and get mobility, yeah, we can't be just leaving, we can't leave that around. So I was so glad when you said that. I don't know, the conversations that I have with people in public are so embarrassing sometimes for other people, not for
They're
me. I'm like, yeah, maybe
never
touching up
embarrassing for
the kids. Like,
me. And
why
I
are they
know, I
recording?
think one of the security guards looked at us like, what?
What are they
So this
talking about?
conference did have security, and the security
Mm-hmm.
presence was very profound to me, having been to other Mount Sinai conferences, and I knew that was to keep everyone safe,
Yes,
especially because of the political times
right.
and all of that. And it was, you know, security in just regular schools, but but there was security
There was,
everywhere.
I mean, I don't know. I've ever been in a place that was more secure. Honestly, I was like, well, damn. But it was reassuring, I think, so that we felt in a place where we could
Yeah.
share as much as we were able to share, where we could accept and have those moments, because we're all in this. We all see it. We all are dealing with it on some level, and so having that security there was reassuring. I mean, and for me, it was my first time in New York, and I was like, oh, okay, well, I'm riding this public bus, so like, let me just take off this badge real quick. I don't know.
Yeah,
Um,
wore my badge partway around the city sometimes in New York, especially. Like, no one's gonna really try it too much in New York during the day. Now, at night,
mm,
sometimes people will try and let their hate show, but
yeah.
yeah. But I'm glad to have met you. I'm glad we got to experience the rectal seal together. I
Listen,
know that sounds so random. I'm like, what are they talking about? It's
and so
RECTOCELE.
let me put in the
Yeah,
chat
put it
for
in
him.
comments because I'm all about people learning things, and it's actually a common issue. And I've been finding some post-op people having like a little puffiness um in the neoperineal area after vaginectomy or closure of the front
Yeah,
hole, and it's a rectocele that wasn't addressed. That they're just like, you're fine, you can address it later. And so having these conversations and even seeing what can be
yeah.
done as far as pelvic floor therapy if someone's already had a closure and they're dealing
Mhm.
with the rectal seal and stuff. And I actually, yeah, we're gonna have to have several talks. So,
I will say I was surprised. So I knew I was coming to this conference, and I was like, I'm gonna be there. I'm gonna be telling them all about pelvic health. They're gonna be like, oh my gosh, you're so smart. And then lo and behold, there are two presenters who are pelvic health specialists who are out here doing this research, who are amazing in this world, and really came up because they were having people come to them with these vaginoplasties and other affirming surgeries, and they're like, oh, what do we do here? And they had to, right? There was a need for it. And so Christy and Christina, they were amazing, did a great talk on it. My biggest complaint, I had many, but
I
this
missed that one. I had to run to a meeting, but I wanted to hear your thoughts on it.
yes, it was just too short. It was too
Okay.
short. It was a nice little introduction. Hey, public health exists. Send people. We can do the things. And they gave them both one
That sounds like,
presentation, but they easily could have had two. They could have been there all week, honestly. So that, but that's coming from my public health world, where I'm like, everyone needs to know this. But don't worry, I held it down for them on Thursday and Friday, and Saturday. So
yeah, sure did.
I was,
Dr. Sharose was asking some amazing questions and was very like open, but also shared her expertise. And I think for us to continue to move forward
yeah,
as people in this work together of all walks of life, because again, the same thing you saw, even though it's a gender affirming surgery for a trans man, like what you saw can help cisgender women.
Absolutely. And does, and it does. And that was where, we'll get into it. But yeah, so it was really good, and I'm glad that they opened it and invited public health into it to understand the importance of it and the other resources and disciplinary care, because this is something that it can't be on one person, and it shouldn't be. And what I heard, I will say the one thing that I heard from the mental health providers is that they're tired. They're tired of having to be the gatekeepers, and that they
Yeah.
don't want, they're not,
Because it's like, oh, you need top surgery, go to your mental health provider to get it a letter. You've had surgery, you need a revision, go to your mental
right,
health provider for a letter. Your genitals didn't come out the way you want, go to and so
right,
you spend more time with the mental health provider justifying why you need things versus getting care for the things that you need.
yeah.
And so we're
And
going
so
to change that narrative, and we're going to work together to show, like, just refer people, and we will all. And I did appreciate that aspect where they said everyone should be doing that basic safety assessment and knowledge of, like, where's your head at? How are you feeling today? And not
everybody.
just leaving it to the psychiatrists and therapists.
Mm, love it. Okay, that's a great place for us to kind of just like wrap it up, because I agree. It should not just be on them. It should be on everyone. Like getting those multiple points of education, anatomy, understanding of what people are asking for and wanting to affirm themselves. It falls on everyone. So that was yes. So all right, Cris, Mr. Cris.
You can call me Chris.
Just recap for the people who you are, what you do, and how they can find you.
So again, I'm Mr. Cris Avery. Mr. Cris, some people call me. You can find me here. My professional page is my Cris Avery Consulting, CRISAVERY Consultant, here on IG, Facebook, all that stuff. But I've been bad about doing my social media on those pages because I'm always out in the streets seeing the people. But you
Really.
can find me, email me. I'll drop my info in the things for the watch back or whatever for folks who missed it. But I'm in New York currently, but I do travel, and I will be traveling to Alabama to do some stuff with Take and see them. But I'm definitely going to be intentional about visiting Dr. Sharose while I'm out there and seeing how we can help y'all pelvic
Mm.
floors get it together and
Get
how
it
we can
together.
educate providers and people more, because I don't just do community education. I
Yeah.
teach providers as well, because good providers are always willing to continue to learn.
Mm. Love it. I love it. Oh, Chrissy, you be saying stuff. Yes, I see maybe a joint workshop in our future.
Yes,
I don't know. I
yes.
know.
US
Um,
PAC is coming up, so I don't know if you're familiar with US PAC.
it's due June 2nd. I'm like, let me get my proposals in.
So we're gonna talk. I'm gonna
Okay.
message you. We're gonna figure it out.
Okay.
But I have one I'm putting in, but after this conversation, I definitely can think of another one that we can
Ooh, I love that. Okay, so yes, Dr. Sharose, I am so, so glad that you were able to have this conversation with me. I met you. The work that you're doing and then just are going to continue to do is amazing. I am in Huntsville, Alabama, but I do offer my affirming services virtually, as well as home visits for people locally. And I also am in the process of starting my nonprofit, which is exciting and scary and just all the things, but a way for me to further provide care for the communities that I'm trying to, for my Black birthing people, for my transgender non-binary community, and for anybody wanting good sex and better sex. So we definitely have ways for us to be able to just continue to work together. And I'm going to just get all your advice on that too, because I mean, all the
Oh
worlds.
yeah,
Frank.
we're gonna talk because I've seen like so, survivors of female genital mutilation and being able to have dignity in sex and
Yeah.
enjoy sex after that. So we
Mm.
will definitely be talking. So be sure to follow both of us. If you
Yes.
don't follow us already, tap that follow button, tap that notification button. So when Dr. Sharose has something going on, you find out first. When I have something going on, you find
Yes.
out first. And when we have something together, y'all be in the front row again for next week.
Ooh. Oh, I love it. Yes. All right. Well, you have a good night and thank you
Thank
so
you for
much.
having me, and thank you. I'd like to give you your flowers for doing this and all you have done and will continue to do. And I'm glad to have met you, and thank you for doing this and the things behind the scenes to make access respectful, courteous, and just there's no words. You don't understand what it means to me as well as community, your willingness to do this. So thank you.
My goodness. Thank you so much.
All right. Everyone, thank you for stopping
Yes.
by, and y'all have a
Y'all.
great one.
Have a good
Take care.
night.